Hi, my name is Janela Andrea M. Parva. I'm from St. Augustine Mandaluyong branch from Caregiver course. This video, I'm going to perform assessing infant vital sign. But first, we need to know what is the proper sequence in assessing the vital sign in an infant. These are the following assessment for an infant: respiration, heart rate, body temperature, weight, height, head circumference, and chest circumference. But first, what is vital sign? Vital sign include heart rate, respiration or the breathing rate, blood pressure, and the body temperature. Knowing the ranges for vital signs for your child can help you notice problems early or relieve concerns you may have about how your child is doing. But first, these are the following materials when assessing an infant vital sign. First, a stethoscope. Let's assume that this is an infant-sized stethoscope. A watch with a second hand, a digital thermometer, and let's assume that this is a weighing scale for babies, and lastly, a measuring tape. But before you perform this procedure, don't forget to wash your hand. Proper hand hygiene is a must. First, we need to assess the respiratory rate of an infant. The normal is usually 30 to 60 beats per minute. So first, we're going to assess for any respiratory distress. Let's see if the baby is having a nasal flaring. So there's no presence of that and no chest restriction. We're gonna assess the breathing count for a 1 whole minute. We're gonna watch the rise and the fall for getting it properly. We're gonna check the rise and fall on the baby's chest and count it for 1 minute. So the baby's breath is 38 breaths per minute. Next, we're gonna assess the baby's heart rate. The normal heart rate for an infant is 110 to 160 breaths per minute. Make sure you're going to use the appropriate size of bell. But let's assume that this is an infant-sized stethoscope. To count the heart rate, we're going to find his apical pulse. It's located at the fourth intercostal space at the left midclavicular line. In the adults, the apical pulse is located at the fifth intercostal space at the left midclavicular line. So now we're going to count and find his apical pulse. Here. 1, 2. Okay. This is where the apical pulse of an infant. Place the stethoscope and listen for 1 minute. Counting infants' heart rate is sometimes hard because they are breathing so fast. And the infant's heart rate is 145 beats per minute, which is normal. Next is checking the infant's body temperature. And now we're going to use a digital thermometer. The normal body temperature for an infant is between 97.5 degrees Fahrenheit to 99.3 degrees Fahrenheit. This procedure is called axillary measurement. To check the body temperature of an infant, don't forget to turn on the thermometer and put it on his armpit. Then put his hands down and wait until the thermometer beeps. The body temperature of the infant is 98.5 degrees Fahrenheit, which is normal. Next is we're going to get the infant's body weight. Before you proceed, ask the assistant to remove the child's clothing to undergarments. Then place the child on his back on the tray of the scale. Put the baby on the weighing scale carefully. finally get the weight of the baby, and his weight is 10.2 kg, which is good for a 2 weeks old baby. Next is the height of an infant. Place your baby in a big paper and get a pen. To get the length, measure it from his head to feet. First, position his head to straight and put a mark. And next, straight his feet and put another mark on his heel. The normal length for an infant is 18 to 22 inches. Gently lift the baby up. Now we're going to measure it by using a tape measure. Use the inches side. The height of the infant is 21 inches, which is good. His head circumference. The normal head circumference for an infant is 33 to 38 centimeter. When getting the head circumference for an infant, place the measuring tape in the largest diameter of his head. Then put it in the upper eyebrow. Gently lift the baby's head. His head circumference is 36 centimeter. Lastly is the chest circumference. Measure it in centimeter. The measuring in the chest is less than 1 to 2 centimeter in the head. Stop. When measuring in the chest, place the measuring tape on his chest and gently lift the baby up. His chest circumference is 36 centimeter. Now we're done with all the procedure, and that is the demonstration in assessing a vital sign in infant. Thank you for watching.